Hi, this is Natalia Nunez, and my presentation is on Chinese herbal medicines. This subject is near and dear to my heart because for 2 years I lived in China teaching English, and while I was there I partook in herbal medications. The first day I entered the country, I was given a little kit that contained amoxicillin, Bactrim, a vial of snake blood, a vial of tiger blood, both to improve my qi and my balance, and then several herbal compounds used for chest colds, coughs, upper respiratory ailments, and whatever else I thought I would need it for. Not much explanation was given, but they told me that if I just took one of the little vials that I would feel better, whatever my symptoms were. Chinese herbal medicine has tribal roots, as do most ancient cultures. By 200 BC, it was firmly established in Chinese culture. The first text on herbal medications was used during the Ming Dynasty and listed nearly 2,000 herbs and extracts. As Western medicine has spread, some of the herbal practices are seen as folklore, yet 80% of the Chinese population depends on herbs as primary health care due to their lack of access to Western medications. In the 1970s, herbal medications became widespread use in the United States and still remain widely used to this day. Herbal medications are the most popular form of traditional medications in history. In China, the sales of herbal products totaled US $14 billion alone last year. The focus of Chinese herbal medications is to restore the balance of energy, body, health, and spirit, to maintain health rather than to treat a particular illness or condition. The herbals treat main complaints or patterns of the symptoms rather than the underlying causes. The aim is to restore, strengthen immunity, and to resistance to disease. There are many complex combinations of herbs, minerals, plants, and animal extracts that are used. Since 1949, China has embraced the use of traditional and Western medicine. Many Chinese considered American medications to be quick and effective in removing symptoms, but not a long-term cure. They will use American medications for acute illness, surgery, and severe disease, and then continue to use their Chinese medicine for long-term treatment. What is involved in the herbal medication treatment? The traditional Chinese practitioner asks about symptoms and examines the skin, hair, tongue, eyes, and pulse, and even the voice to detect imbalances in the person's qi. More than 3,200 herbs are used, and 300 mineral and animal extracts are used in 400 different formulas that are passed down from generation to generation. One or two herbs that are said to have the greatest impact on the symptoms are used along with other ingredients to help additional minor issues. Some of the herbs act as a vehicle per se, getting the compound to a specific area, or the herbs are used as an antagonist to help the other stronger herbs work better on the ailment. And the herbs come in the form of teas, powders, pills, tinctures, or syrups. There are many conditions for which herbals are most frequently used. They include both acute and chronic conditions. The acute conditions include head or chest colds, respiratory ailments, stomach or intestinal illness, severe headache, or recurring pain from injuries. Chronic diseases are arthritis, gout, menopause, premenstrual syndrome, memory impairment, neck and back pain, depression, and anxiety. The conditions that herbals are found most helpful for are arthritis, depression, pain, memory improvement, and menopausal symptoms. And the herbals continue to be used mainly to maintain balance and well-being in the Chinese. There are many challenges faced in the use of herbal medications, not only in China, but in the world throughout. Further study of the products are needed to test for safety and effectiveness of the herbals. The disparity in regulations in China make it difficult to assess the quality of a finished product. Safety, effectiveness, and quality depend on the quality of source materials and how it's handled throughout production. It is still not known in many cases what ingredients in the particular herb works. Many times, all the ingredients in the herb work together to produce the benefit. There are many factors that determine how effective the herb will be, such as the climate, the soil's condition and quality, and when and how it was harvested and processed. Many people believe that because herbals are natural and they get them from a traditional healer and have nothing to do with Western medicine, that they carry no risk for harm. But they can be harmful if taken inappropriately or it's of a poor quality. Toxic herbs may accidentally be harvested, causing harmful reactions in those who take these compounded medications. Nearly 1/3 of Chinese herbal medications and remedies were found to contain mercury, arsenic, and lead in toxic quantities. Others were found to contain prescription medications such as Valium and warfarin, which is an increased concern these days since many Chinese who can afford to do so are also taking Western medications. And it's important to remember that any herb can cause an allergic reaction, especially in those who have plant-based allergies. And another problem are counterfeit and unadulterated products, which can also be a serious patient safety threat because they feel that they're getting one medication and they're actually just getting a conglomeration of toxic substances, fillers, and placebos. And in conclusion, regulations should be integrated in the national policies of China so that providers and products maintain the quality necessary to ensure patient safety. The World Health Organization recommends ensuring patient safety by increasing the skills and knowledge of traditional medical providers. Also needed are safe, effective, quality products and practices based on the latest scientific evidence, not only performed by their country, but other countries who are using traditional medications. And due to Western influence, the Chinese need to be educated on the importance of divulging what herbals are being taken with their Western prescribed medications, so that interactions and adverse reactions can be noticed and treated before they become severe. Thank you.